and we know her as an active academician. And today she is going to moderate this very important topic on preconception care. Dr. Himabindu, if you can have the honor of introducing the star-studded panelists. Over to you, madam.
Thank you so much, Dr. Ashim. Again, very good evening to all, especially our president of our Docent Health Academy, Dr. Geeta Patil, and the past president, Dr. Sukanta ji, and all the office bearers of the local branch of, the West Bengal, and chairperson, Dr. Champak Das, Dr. Vinay Aswa, along with Dr. Ashim Ghosh, planned this very important program on preconception care. My regards to Dr. Atanu Badra, Dr. R.G. Patil, Sudhir Mishra, Kalpana Datta, and Dr. Chatterjee, and all those who have joined this webinar. This topic has been selected and it's very close to my heart. This preconception care, it has been on my, as a priority since last 2 years. We are trying to sensitize people that it's time we talk about preconception care. I will try to share the screen to introduce my panelists. We have very, you are able to see my screen?
Yes, ma'am.
Yeah, so it's on the full screen. Yeah, thank you. So we have all, I'm the moderating the session. And as I said, this topic is very close to my heart. And I'm very much closely associated with the 4 panelists today. Dr. Sonia couldn't come, but all the 4 of them, Dr. Deepa, Dr. Prashant, Sonia, and Dr. Manmeet, they have been associated with this topic since last 2 years. So we have been developing modules. This screen is not moving.
Ma'am, click on screen and then it will move.
Yeah. So this is the esteemed panel I have. Dr. Deepa, she's very, very enthusiastic to introduce her. Very young, but very, very dedicated pediatrician from Kerala. She's been a specialist in, of course, pediatrics, and then she's also done a PGDAP, and she's been a senior specialist pediatrician at Kerala. To shortly introduce her, I would say she's a dedicated worker of IAP, and she's been associated with the module on preconception care since she's been under the action plan also. So she's been a secretary of AHA Kerala and been associated with a lot of academic work in IAP and also AHA. We have this young dynamic Prashant Kariya with us. We know his bubbly energy is there. He's been associated with not only the preconception care, but a lot of other topics in IAP, and he's very tech savvy, and he's been with us even in developing a position paper. We are going for publication of preconception care. All these 4 of them are doing excellent work in editing and preparing the paper. Thank you, Prashant, for accepting to be with us. Dr. Manmeet Sodhi, another dynamic person from Punjab. We've seen her, how she has hosted our Amritsar AdultsCon. She is a professor and HOD at Pediatrics in Amritsar, and she has keen interest in many subjects, including adult medicine. She's been an office bearer in many of the organizations, and including the Academy of Pediatrics at Satluj, and she's been associated with a lot of technical modules. Now, right away, let us go into the discussing why this is important. We all know that this topic was not very much discussed earlier in either in IAP or neither, I think, in FOXY or any other organizations. Preconception care. It has just come to my this thing for last 2 years. I was just thinking, do we have guidelines on preconception care? Can I request all others to mute? Yeah. So this is an important aspect because not only just educated, even uneducated, everybody, they're just going for marriage. And once after, or even conception happens without planning, and they later realize that I should have done this before, done that before. Even the gynecologists or other, they have a lot of issues. They say that you should have been prepared before conceiving. And this is a topic of little hesitancy. Many people feel hesitant to talk about preconception care. Even the couples don't discuss how to prepare. So it's all about shyness. There's no open mind about discussing this topic in the families also. So let us demystify it make it as a scientific thing. And we have to give some guidelines to our young adults, since Adolescent Health Academy is now taking care of young adults also beyond 18 years. So we thought it is appropriate to bring up this topic and bring out some guidelines and recommendations for our young couples who want to conceive. So let us give the very best to our next generation by preparing even before conception. So with this little introduction, I would like to ask Dr. Deepa about how she can help this Miss Aparna. So this is a case. Miss Aparna has come to our OPD with her 5-year-old daughter, Amaya, for vaccination. And Amaya is asymptomatic and is doing good. Aparna was planning her next pregnancy, because these situations come to us as pediatricians, and we have an opportunity to help even the mother for the next pregnancy at least. So this, she had a concern about her metabolic thing issues like hypothyroidism. She's been on medication, levothyroxine, and she has not yet started taking it, and she's worried about whether it will affect her pregnancy. So Dr. Deepa, is this a matter of concern? How important is being eumetabolic before conception? Can you elaborate on the problems and complications, and also mention few recommendations for this couple? Dr. Deepa, over to you.
Thank you, himabindu ma'am, for those kind words.
Can you be a little louder? Can you be a little louder? Your voice is coming out a little very weak.
Himabindu ma'am, for those kind words of introduction. Am I audible now, ma'am?
Dr. Vittalji, can you please mute yourself? Yeah. Dr. Brunanjay? Dr. Brunanjay ji, can the hosts mute these people? Yeah.
Madam, you are the host, so you have to just take the trouble of muting people. Sorry, madam.
Can you also become a co-host to help me? Yeah, I'll mute them. Yeah. Yeah, please go ahead, Dr. Deepa.
Am I audible now, ma'am?
Yes.
Good evening, one and all. And thank you, himabindu ma'am, for those kind words of introduction. And greetings to one and all from the southern state of Kerala. At the outset, I would like to thank all the organizers for this.
Ma'am, if you are using
Dr.
a
Deepa, your
headphone,
voice is not very clear. Little
If you
louder,
are-
please.
if you are using a headphone, please remove it so that the voice comes clear.
I'm not
Atanu Bhai, Atanu Dada, thank you for being present today. Your blessings for the
Namaskar,
program.
namaskar.
Atanu has joined.
Yes.
Yeah, all right.
Yes, Deepa.
She is not audible, madam.
Deepa, you're not audible. Very weak voice. Your voice is not coming out clear. If you're using headphones, kindly remove it.
audible now, ma'am?
You are audible, but little weaker. Please go
Okay,
ahead.
can you join
Please go
through
ahead.
phone? Deepa,
Yeah, she
can you
can
join
come.
through phone?
She can come to near the phone.
I'll join on my phone then, sorry.
Yes, please. Because slide is being operated by Himabindu, so you can join by phone.
So it's very, very important. Being eumetabolic, many young teenagers don't realize, and it can be an accidental pregnancy or a planned pregnancy, but we all wish that we advocate our young adults to have a planned pregnancy and to prepare themselves before conception. And somebody has to discuss this, and we all pediatricians can help these young adults. We have always an opportunity in the OPD also. When our mother comes for the second pregnancy, at least we can tell. So we have an opportunity. Let's start propagating about preconception care. We are the first persons. IAP is the first organization to bring out guidelines on this preconception care. Very soon it will come for publication. So this is the group which is doing that.
Okay. Am I audible now, ma'am? Am I
Yes,
audible
yes,
now?
Much better,
Yes,
much better.
very
Perfect,
clearly
perfect.
audible.
Very,
thank
very
you.
good now. Yeah.
I'm so sorry for the
No,
technical
no
issues.
issues. No issues. Go on, madam.
Okay, so greetings from the southern state of Kerala, and I would like to thank each and every organizer for this great opportunity. So the topic per se is importance of being metabolic prior to conception. So as you all know, pregnancy is a beautiful phenomenon with many physiological changes. There do occur hormonal and metabolic alterations as well. But pregnancy many a times is complicated by obesity, metabolic syndrome with diabetes, hypertension, and thyroid dysfunction. Ma'am, next slide, please. I would like to share some alarming statistics. This month issue of Lancet has shown that global obesity has increased 4.5 times from 1990 to 2022. That is twice doubled. And WHS red flagged our country, India, for the high rate of rise of childhood obesity. And it said that by 2030, India will host around 1 in 10 of the obese children. The increasing prevalence of obesity translates to an increased prevalence of metabolic syndrome. And the prevalence rate, ma'am, the previous slide, please, ma'am. The prevalence rates of pre-diabetes, diabetes, and metabolic syndrome among adolescents in India has been shown by various studies to be 5.4%, 16%, and point. And could you please mute that? And thank you, ma'am. And 0.56% respectively. And the previous slide, there was a map, picture of a map, ma'am. Could you please show that slide once? Yeah, this shows the prevalence of metabolic syndrome among adolescents in India. And the darker the shade, greater the prevalence. And we can see that states like Tamil Nadu, Gujarat have high prevalence, and the northeastern states too. Next slide, ma'am. Now, what is metabolic syndrome? We all know it's a combination of obesity with dyslipidemia, with diabetes and hypertension. But the definition per se is increase in waist circumference more than 90 centimeter in men and more than 80 centimeter in women. This is the Indian cutoff. Then increase in triglyceride more than or equal to 150 milligram per deciliter. A reduction in HDL less than 40 in men and less than 50 in women. Blood pressure more than or equal to 130/85. And increase in fasting plasma glucose. Please note, it's not 126 like diabetes, it is just 100. So if the blood sugar is more than 100, that also qualifies for metabolic syndrome. So 3 out of the 5 criteria defines metabolic syndrome.
Very important to note this. Yeah.
And diabetes during pregnancy, we know these complications like miscarriage, preeclampsia, preterm labor, macrosomia, birth injury goes on. Next slide, ma'am. Yeah. Now, second to diabetes, thyroid disease is the most common endocrine condition encountered in women of reproductive age. And coming to the prevalence of hypothyroidism and hyperthyroidism, we know that hypothyroidism is 2 per 100, whereas hyperthyroidism is much rarer. It is 2 per 1,000. And the complications of hypothyroidism include decreased fertility and miscarriage. If a couple comes to you with infertility, the first test, one among the first tests will be a thyroid function test. Preeclampsia, abruptio placenta, low birth weight are among the other complications. And we all know maternal hypothyroidism can lead to impaired neuropsychological development in the offspring. Whereas hypothyroidism causes congestive heart failure, preeclampsia, thyroid storm, miscarriage, premature birth, etc. And in newborns, it can cause tachyarrhythmias and heart failure. So what are the recommendations?
Dr. Deepa?
Yes, ma'am. Next slide, please, ma'am. Yeah. Ma'am, please go on, ma'am. Yeah. Diabetes mellitus. Every woman who plans to become pregnant should have a diabetes screening according to WHO criteria. So what is WHO criteria? An oral glucose tolerance test, that is taking 75 gram glucose and after 2 hours doing a plasma glucose, and it should be more than 200 milligram per deciliter. Or a fasting plasma glucose more than or equal to 126 milligram per deciliter. Both qualifies for diabetes. Women with pre-existing diabetes, we should aim for an HbA1c less than 6.5%. Ma'am.
There is an interruption,
I'm just
madam.
trying to mute him.
Dr. Himabindu, can you please make Dr. Ashwin Ghosh co-host? Only you can make it so that he can control the.
Yeah, because I have to do the muting. Please, somebody can manage.
You just you click on Ashwin Ghosh and then you make it co-host.
Can you do it, madam?
Among the participants, you can take him, ma'am, and you can make him co-host.
Now let us go on. I think it is smooth now. Yeah. Yeah, please continue, doctor.
Yeah. Women with pre-existing diabetes, we should aim for an HbA1c less than or equal to 6.5 and a fasting plasma glucose 80 to 110 milligram per deciliter. But the point to be noted is that we should advise them to postpone pregnancy till these goals are met. Next, ma'am.
Yeah.
Hypothyroidism. Women in the preconception age should consume 150 microgram of iodine per day. Next. In India, considering the high prevalence of thyroid dysfunction, and universal thyroid screening with TSH is desirable in preconception period. And women should receive education regarding the negative effects of hypothyroidism in pregnancy. Why? To ensure compliance. And women with subclinical hypothyroidism. When do you say subclinical? That is when the TSH is between 2.5 to 10 with a normal free T4. we should do an anti-TPO antibody to decide on further management plan, and an endocrinologist should be involved in such patients. Whereas, next, yeah, women with overt hypothyroidism, that is TSH more than 2.5 with a low T4, free T4, or a TSH more than 10, they should be treated. Hyperthyroidism prior to conception, euthyroidism should be attained, and also if pregnancy is planned within 2 years, surgery is preferred over radioactive iodine.
Thank you, Geeta. You have touched upon many aspects of metabolic issues. Now, what about, what should be the ideal body weight? For the young couple, what we can advise? Because a lot of malnutrition is there, or obesity, both can happen. What is the impact of malnutrition? So can you just give us recommendations about the diet for the young couple?
Yes, ma'am. So the ideal body weight in preconception period, that is a weight BMI between 18.5 to 24.9 is considered to have optimal fertility and healthier pregnancy outcome. This is as per MOH and family welfare.
Yeah, very, very important to tell our young couples about this BMI.
So now here we see a pregnant lady who has a sedentary lifestyle, who consumes junk foods, who is into substance abuse. So what happens is that apart from the regular genetic factors, there are other mechanisms by which the obesity can be transferred to her offspring. One potential mechanism is epigenetic modification. So what is epigenetic modification? That is, these are certain changes that happens to DNA without actually altering the DNA sequence. And these changes are heritable but modifiable. And these changes or these mechanisms include DNA methylation, microRNA, and histone modification. Another interesting mechanism that is coming up, lots of studies are coming up, is gut microbiota's role in obesity. And one point I would like to stress here is there has been recent evidence that gut microbiota is vertically transmitted from the obese mother to her offspring. These obesogenic gut microbiota has been recovered from amniotic fluid, from the cord blood, and also from placenta. So thus a newborn is born with inborn susceptibility to cardiometabolic disease. Plus now the child is exposed to sedentary lifestyle and other junk foods and other potential environmental factors. This leads to childhood obesity, early onset diabetes, and cardiovascular disease. Further, this child goes for a pre-pregnancy obesity and insulin resistance. Again, going for a generation next of a obese generation. So this is the intergenerational cycle of obesity.
So
next slide.
Just this slide on our OPD will help a lot. For public awareness, we can keep this in our OPD whenever the patients are coming. We just put there outside. So this gives a lot of information. Over to the just a minute, sir. Co-host bana Ashif bhai ko. Unmute nahi, I want to mute them.
यस, आप आशिम घोष के नाम पे क्लिक करेंगे तो 3 डॉट दिखेंगे।
एक मिनट यार।
तो ना तुम्हारा म्यूट को
कंटिन्यूअसली बात कर रहे हैं
কথা বলছে সব চলে আসছে মিটিং।
Please make everyone mute except the speaker and the moderator.
Ashim Ghosh.
Just make me the co-host, madam, so that I can.
Yes, sir.
असीम घोष सर, नहीं तो आप क्या कर सकते हैं, डायरेक्टली रिक्लेम होस्ट करके मैडम को को-होस्ट बना दीजिए।
प्रशांत करिए, आपको बनाती हूँ ना। 3 लाइन्स आया है। I'm making you host.
अरे प्रशांत पैनलिस्ट है, वो नहीं कर पाएगा ना।
कोई बात नहीं, आप अभी बना दो।
आशिम घोष को बनाते हैं।
डाटा आशिम घोष या डाटा चंपक दास, किसी को बना दीजिए।
इसमें को-होस्ट बनाने के लिए मेक होस्ट है, दूसरा मेक होस्ट बनाना, उसको क्लिक करना है प्रशांत।
So that, but if you make me the host, I will. Then you cannot share the screen.
Yeah, co-host. There's no option for co-host.
No issue. I'll tell you. Just make Ashim Ghosh sir a host.
Host बना दूँ?
But then he can. But madam cannot share the screen then.
Just 1 minute. Yeah. हो गया? Okay. अभी असीम घोष सर शेयर स्क्रीन का जो ऑप्शन दिख रहा है ना आपको, उसके ऊपर क्लिक करेंगे ना, तो ऑप्शन आएगा कि एवरीबॉडी कैन शेयर।
शेयर स्क्रीन के ऊपर हम किए, multiple participants can share simultaneously. Okay. I've done that.
Ma'am, restart screen, sorry.
Yeah.
Just see whether you can share now, madam.
Yeah. Yes, sir. Yes, sir. Now it's visible.
Done.
Done. Thank you. Right.
Okay.
I'll mute the participants. Just a minute. I'll be muting the participants.
They are not even listening to our request to mute themselves. Yeah, it's okay. It happens. So please continue, Deepa.
Am I audible now, ma'am?
Yes.
Okay. So now what are the impacts? If you look at the impacts of underweight on the mother, it can lead to morbidity and death in general. And overweight obesity can lead to, we know the complications, gestational hypertension, diabetes, preeclampsia, miscarriage, etc. Short stature, obstructed labor is one. Micronutrient deficiency can cause reduced fertility, preeclampsia, preterm birth in the preterm birth. Now, regarding offspring, when we were undergraduates for pharmacology exam, if somebody asked what is the side effect of any drug, blindly we would write nausea, vomiting, and anaphylaxis. Likewise, here, whatever be the condition, most of them, the offspring can cause preterm and low birth weight. So, along with that, accordingly, the conditions, we know most of them. Next slide, ma'am.
Yeah, it's not moving. Okay, we have to click on the. Yeah. So,
now, what
is the ideal diet you would like to recommend for the young people?
Yeah, these are the recommended dietary allowances. Energy, we know the preconception period, women will require 2000 calories per day, kilocalories per day, and pregnancy, they require 300 extra calories, and lactation, they require 640 extra calories. And proteins, they need more proteins during pregnancy and lactation, and rest, iron, and calcium, vitamin D, vitamin B12, especially in vegans, it's important.
Yeah. So I think this table also we can display in our OPDs for young couple. So what should be the diet like and what they should be, what exactly the nutrients they should receive. Thank you, Dr. Deepa. Now, what about micronutrients?
It's micronutrients. We all know folic acid to prevent neural tube defects, 400 microgram daily for at least 4 weeks prior to pregnancy and should be continued for the first 12 weeks of gestation. And elemental iron, calcium, and vitamin D supplementation is required during pregnancy.
I would like to insist here, folic acid. Most of the time, when the conception happens, they report to a gynecologist normally. It's already 2 months, they are from the last LMP. So the important period of around the conception, the period has gone, the important critical period. So I think we should tell a young couple, if they are planning pregnancy, to start 4 weeks prior. 400 micrograms of folic acid, extremely essential to prevent the birth defects, which is so much preventable. Unnecessarily, we are putting the burden of birth defects in our society. This is preventable. Yeah, thank you for highlighting that, Dr. Deepa. Now your recommendations on BMI and diet, short key messages.
Every woman should get her BMI determined at least once a year. And regarding exercise, 30 minutes per day for 5 days a week of moderate intensity physical activity, that is aerobic exercise is recommended, plus 2 strength training sessions per week, that too on non-consecutive days is recommended.
Exercise, very, very important. Yeah.
Now, overweight women, we need to counsel them on diet modification, aerobic and strength training exercises. And very important thing is the goal should be realistic, 5 to 10% weight loss over 6 months period. Whereas for underweight women, we have to counsel them on the hazards, risk associated with future pregnancies, including infertility and increased risk of preterm birth, low birth weight and birth defects like gastroschisis.
So we have both these spectrums. We have a lot of underweight, young girls, teenagers who are zero size. We have to tell about them, the problems they can face, and also obesity. Obese women are also now increasing. So after we finish this diet and BMIs, how about metabolic issues, which is a very important, situation we are facing. Like we have to talk about all this, and pediatricians need to know. Now over to Manmeet ji. Can you just highlight the importance of reproductive health for the male? Is it important, and why it is important in preconception care?
Thank you, Dr. Himabindu ma'am, for this question. And I think Dr. Deepa has actually outlined 2 very important vitals, which are part of the preconception care counseling. But what I am going to talk about is something which is usually kept under the covers. Females usually do not talk about their reproductive health, and it is considered a taboo, especially like sexually transmitted infections, then acute and chronic pelvic infection, urinary tract.
Sir, please unmute Dr. Manmeet. Yeah.
No issues, ma'am. So, even in your OPD, you must have seen that adolescent girls who are in the preconception period, they usually do not talk about these problems, menstrual irregularities, dysfunctional bleeding, PCOS, and all these are ignored. But they are very vital to preconception care. How they are vital? Because if there is chronic or acute pelvic infection or sexually transmitted infections, they can cause a buildup of scarring in the fallopian tubes and prevent fertility. And it can have long lasting complications for a couple who is planning pregnancy. So, it is important to address the reproductive health of the female at the earliest. Next slide, ma'am. Talking about vaginal discharge. You must have seen young adolescent girls shying to talk about this. In the OPD, they don't want to discuss that they have a vaginal discharge. And there are many misconceptions and myths related to vaginal discharge. So this kind of a slide can be put up in the reception area where the young girls are waiting. They can even have a look at it. What is actually a healthy vaginal discharge and what is a abnormal discharge? So usually the healthy vaginal discharge is clear or whitish in color. It has a very slight odor and it can leave a yellowish tint on the underwear. And it can change consistency throughout the menstrual cycle. Whereas if we want to talk about an abnormal discharge, it will change in consistency to yellow, green, or sometimes gray. And sometimes it may leave cottage cheesy color material and cause vaginal itchiness. Sometimes it may look foamy or frothy, and it can have a strong odor which could be like of a fish or something like a yeasty smell. Sometimes it can be blood stain. So if we educate the young girls about vaginal discharge, it will prevent a lot of acute and chronic infections. Coming to UTIs. UTIs have been mostly missed in young girls, but they are prone to UTIs because there is a shorter length of urethra, there is proximity of the vagina to the anus. Sometimes there could be urethral trauma during sex, and uterine prolapse also has increased incidence of UTI. Another topic which is usually missed by the young girls is they don't talk about something going wrong in the breast. They could feel firmness, there could be a nodule, there could be some ulceration or a fruncle coming up, which can lead to an abscess. So, we should educate young girls to have breast self examination to rule out most of the problems or disorders related to the breast. They should know when to call the doctor. It is very important if there is a change in how the nipple looks, like there is a pulling in of the nipple or there is a skin dimpling. If there is a change in the skin color or the texture over the breast, if they can feel a lump during the breast self examination, or if there is a discharge which is clear or bloody, which is leaking through the nipple. All these are important points where the young girl should consult the doctor. Next slide, ma'am. So, coming to a very important vital in preconception care. With the increase in obesity and the metabolic syndrome in young girls, the PCOS is also increasing. So, we should follow the diagnostic criteria, which includes both abnormal uterine bleeding for age, persistent symptoms for around 1 to 2 years, and there should be evidence of increased androgen activity, like the persistent increase in testosterone levels, moderate to severe hirsutism, and severe inflammatory acne vulgaris. So, we can go through the recommendations for caring for our young girls through the preconception care. We should screen all women of reproductive age group for chronic medical conditions and STIs. If there is PCOS, it should be appropriately managed. Menstrual irregularities should be taken care of, and one should work towards preventing recurrent UTI in young girls because fertility can be affected by it. Also, promote awareness about breast self examination and early and adequate management of vaginal discharges. This is how we can promote and manage reproductive health of the young female.
Thank you, Dr. Manmeet. So clearly explained. Reproductive health is so very important. But normally, we tell our children, shh, don't talk about it. And that's how we rear our children. So something is so private. We say private part, so private hi reh jata hai. And many of these issues are not even discussed with the parents also. So it's very important that you have highlighted these points, and we pediatricians open up this during, if there's any opportunity to talk with young adults, or at least display this self-educated material, educative material, IEC material in our clinics. Now over to you, Prashant. This is about the female. Now, what about the importance of having a healthy reproductive tract for a male? What are the common problems they face, and how will you manage, these challenges in a male? Do you think it's only all about female being ready for preconception care? Male ka kya role hai? Is there any role? We traditionally don't give importance to a male. What is your take?
So definitely there is a role of a male, and that's why among all the female panelists, I'm the only one male wishing all the females a happy Women's Day in advance. We are talking about a menstrual hygiene and everything about a sexuality about a girl, but we don't talk much about a spermatogenesis in boys. See, there are so many issues which can be there in a reproductive health of a boy is concerned. There are so many boys who are having a erectile dysfunction or a premature ejaculation. This can be a problem. They may be having some loss of libido, or sometimes they may be having some issues related to a masturbation. Some testicular disorders or sexually transmitted infections are also common in them. Delayed or precocious puberty in female is talked much about, but that is also common in boys. There can be some genital injuries during some procedures or traumas, or there can be some hormonal imbalances. The hypogonadotropic hypogonadism, like that type of thing, is also common. Even we have seen testicular cancers in adolescent boys, and that can be a fertility problems. See, when we are talking about a fertility problems, male and female as such are equally responsible for these things, but many a times only female is being blamed. 1 in 3 fertility problems can be attributed exclusively to males, both in 1/3 and female in 1/3. So that is how the fertility issues are there. And most important thing, this majority of male infertility, they are idiopathic. Sometimes they are due to psychological issues. These sperms which are there, they are damage to a sperm DNA. That can happen due to multiple reasons. And if the sperm membrane is damaged, then the sperm motility and ability to fuse with oocyte is also a problematic. As I already said, 1/3 cases are idiopathic. There are some medications or surgical procedures. Say for there was a varicocele or a hydrocele, and that surgical procedure may have lead to some complications that will lead to this type of issues with sperm. Preconception care, a lifestyle diseases which are there, and in which Deepa has already talked about a diet. Stress we will be covering next. Diet and obesity is there. Smoking, alcohol, drugs, and the mobile use. Now you will be wondering why the mobile use has been used with this form. So the radiations which are coming from the mobile, or the heat which is generated while the mobile is in the pocket, it's been seen that this heat can damage the testes, and there can be a sperm issues with that. The environmental pollution or a heavy metal exposures can also cause the issues with the sperms, and the systemic infections, even the genitourinary infections, mumps, we all know, can cause orchitis, and that can be a issues. Testicular trauma is in case of a torsion or a vasectomy. I mean, this is something surprising which I came across the literature, that vasectomy is one of the method in adolescents for a contraception. Now, this was something surprising, but this can also have some issues. Some autoimmune antibodies which are against the sperms, or a genitourinary obstructions and a testicular inflammation will also lead to a spermatic issues, and chronic diseases. And this is most important, the diabetes, the hypothyroidism, or all other renal anomalies can also have these issues. So this must be addressed. Yeah. So in boys, usually we say start with weight, height, and BMI. That is the most important thing. And if there is some fertility issue which has to be found, then most important is the semen analysis. the semen count of 15 million sperm per milliliter is considered as a normal, more than 15. If it is less than that, that can be a problematic. 40% time it is usually due to the decreased motility, so that will be a problem. And if the shape of sperm is not normal, I mean 4% issues are due to that, so that is to be checked. Now, while doing this hormonal testing, the FSH, LH, and testosterone, mind you, why we say this? Because if we see in my previous slide, I've already shown that the spermatogenesis in that, the hypothalamus is actually giving a signal to pituitary to secrete the FSH and LH, and then in turn, the FSH and LH is giving a signal to the Sertoli cells, and by that, the testosterone levels are increasing. If there is imbalance in any of this due to any reason, then there can be a problem. As we already seen, there can be some testicular cancer issues, so the biopsy or genetic abnormalities are there, then the karyotypic and genetic screening is also recommended. So this is what we check while we are checking for the reproductive health of a male.
Yes. So thank you so much. Yeah. When to intervene, Dr. Prashant?
Yeah. So this is most important, when to intervene. See, usually what happens is if there is some issue and we say that we will intervene now and there will be a result. So no, it is not like that. The sperm development usually takes up to 3 months. Usually the same is egg maturation is there. But for a healthy sperm, for today, it is related that all the habits or all the exposure has to be stopped 3 to 4 months in advance. When we are talking about a preconception care, the majority of birth defects, and this month is a birth defect prevention month. The 2nd March was a birth defect prevention day, in which we say the first 2 months are mainly important for the development of organs, all the organs. So if we want that sperm and egg qualities are good, then at least the intervention should be started 3 to 4 months in advance. In that, majority role is of our lifestyles, like the good healthy habits and minimizing the exposure to harmful substance is most important. So this is what we do. And next slide, ma'am. If we want that everybody should remain healthy, then all these things, a nutrition and exercise, a vaccination, substance, and stress should be avoided. And next, if we find that there are some issues, then the aromatase inhibitors like the HCG, selective estrogen receptor modulators, or a combination is recommended for infertile men with low serum testosterone. There is a questionable role of supplements like the antioxidants, vitamin C, carnitine, selenium, zinc, CoQ10. All these are actually been used, but questionable value is there. If man is having an idiopathic infertility, then we may consider treatment using an FSH analog. With the aim of improving the sperm concentration, the pregnancy rate will increase and the live birth rate will also increase. If there is some surgical issues, then varicocele should be considered in males who are having palpable varicoceles and infertility, and if they are having abnormal semen parameters, except for the azoospermia. Thank you, ma'am.
Yeah, thank you. I think that was so important. We normally have a tendency to neglect the male partner. So, hamesha there's a stress on the female, and if a conception or any other reproductive issues. So, the male has a very important role, maybe equal important role, or even more, I should say. And I think alcohol is not allowed, at least 4 months before. Alcohol, smoking, all this exposure has to be stopped. Take good healthy diet and antioxidants. They have a role, and mental and physical in general good well-being. This is so important. Now we'll have to, let's move on to another important thing. This is a question for I'm not able to see. So Rishit,
I'll take, ma'am.
Yeah, you will take this, Dr. Manmeet. Yeah. So Rishit, he's a 5-year-old child. This is the scenario. Let's see. This child has come for a vaccine booster at 5 years of age. He was brought by his mother and a distant aunt. Now, this, normally when they come with the family, they start sharing with you all other concerns in the family. Now, the aunt is complaining of general weakness and lethargy, planning a first pregnancy and needs advice. And, for a detailed family and personal history was obtained. Now, she is a Sindhi by caste and resident of Gujarat. So, what is your take, Dr. Manmeet? What is the what suggestions you would give for her?
Ma'am, the first
There's
point
a positive history. There's a positive history of thalassemia minor in one of our siblings, and this is a predicate tree your resident has drawn for you. So you have, after looking at this, what sort of counseling, genetic counseling you can give to this family? Very, very important.
Yeah, ma'am, the first point I would like to actually put forth is that all pediatricians should work on giving anticipatory guidance during the preconception care period. And if a lady who has come to you with her nephew and she just wants to have a query, then you should give her all your ears and listen to her. Because if we have seen this, there is a positive history of thalassemia minor in one of our siblings. So, what is the role of genetic screening? So, regardless of family history or any other variables that come around, there is a background risk of approximately 5% for significant genetic abnormalities in every pregnancy. So, for every pregnancy, there is a risk of 5%. So, why we should care about this? Because if we miss out in the preconception care time period, it is going to come out as a genetic problem later on. And due to cultural and social customs in India, many subpopulations in India are still having consanguineous marriage. And in this consanguineous marriage, because of accumulation of genetic traits over a period of time, particularly autosomal recessive conditions, they can be more seen. So, how do we actually identify these couples? So, if there is a consanguineous marriage happening, or you come to know through the history, then definitely you should go for carrier screening or testing. And what is the best time to do it? It is the preconception phase. So, if we see this case, we tested the patient for CBC and reticulocyte count, MCV, MCH, and ferritin. Also, hemoglobin electrophoresis was done and DNA studies were carried out. And we could have arranged partner testing if the MCV is less than 80 femtoliters or MCH is below 27, or if there is a abnormal hemoglobin electrophoresis. Next slide, ma'am. So, what are the screening guidelines for thalassemia, which is a major problem that we are encountering, autosomal recessive? So, we could have extended family screening and counseling of families of students or people who are detected to be carriers. It is very important to do it in students. If you haven't done it at school level, then in hospitals where the premarital screening is done, or when the mother comes, and preconception screening can be done if it was missed out earlier. And during antenatal checkup, there is no point in missing or screening for thalassemia trait. And this is being routinely done. But the emphasis should be to have it earlier. And the recommendations are that a thorough history should be taken for the presence of any of the following factors to identify couples who actually need genetic counseling. If there is a consanguineous marriage, if there is a known or suspected history of hereditary disease in the family, any family member with same or similar disorders, if the parental age is more during pregnancy, which can actually predispose to many congenital disorders like Down syndrome, and if there has been a teratogen exposure or infection during early pregnancy. So these are all factors which call for a genetic screening and counseling of the couple. If there is an ethnic background which is associated with increased prevalence, like in this case, if you go back, the history was of a Sindhi lady in which the thalassemia disorders are very common. So if there is an ethnic background, be very careful. If there is presence of birth defects, chromosomal abnormality in any of the previous child or any family member, bad obstetric history, if there are recurrent pregnancy loss, it is very important to do genetic counseling and then genetic screening. And if there is family history of early onset cancers or earlier than expected of a non-malignant disorder, these are all points where we need to do genetic counseling and screening. So this can help us in the preconception period to take care that the baby is not born with a congenital or genetic defect. Thank you so much, ma'am.
Thank you, Manmeet. Very, very important. हमेशा अपने इंडिया में ना हम कुंडली मिलाते रहते हैं. So apart from the kundlis, I think we should really take care of the metabolic history of both the families and also reproductive health कैसा है. And the genetics, especially the incidence of consanguine marriages is so high in India. We have to look at genetic mapping in the families and prevent genetic disorders. This is I think, responsibility of all of us, and we should propagate this knowledge among young adults. So over to Dr. Manmeet once again.
Ma'am, just one thing which I would like to say is,
yes.
You already said that कुंडली मैचिंग करना चाहिए थैलेसीमिया के लिए हमें कि भाई थैलेसीमिया स्क्रीनिंग होना जरूरी है. हाँ, कुंडली के अलावा ये होना चाहिए. One thing which I would like to say is why we are focusing more on this is India में every year 10,000 children are born with carrier states and अगर डेटा जो हमने देखा था ना मैम स्क्रीनिंग गाइडलाइन करते वक्त तो around 42 million people in India are actually living in a carrier state and if we miss them then a thalassemia major child will be there which is problematic. Same way when we are talking for a West Bengal, HB electrophoresis is important. They will be able to tell us more detail about that. But what I read was HBE is most common over there. I mean, it depends on the area also. So this is one more thing which I wanted to add. Thank you.
Thank you for adding that point. Now over to vaccination, Manmeet. हमेशा टीका है ना छोटे बच्चों को बोलते रहते हैं कि by even 5th year we are worried they don't complete the vaccination. Now we are talking about vaccination for young adults, adolescents, now even beyond preconception care. Any role of vaccinations, how important it is, and what sort of advice you would give for the young couple during preconception?
Yes, ma'am. Surely, we usually talk about, vaccination in young children. And by the age of adolescent, we actually, stop talking about it. But it is very important because the preconception vaccination actually can lower the risk of in utero disease transmission. And preconception vaccination can passively transfer antibodies to the fetus and the newborn. It can also reduce maternal morbidity and mortality. And we all know that infections with measles or rubella during pregnancy are linked with low birth weight, premature births, spontaneous abortions, and the well-known congenital rubella syndrome, which is associated with significant morbidities.
So what are the recommendations?
Yes, ma'am. And I think this will be a very new thing for most of us because when we worked on the preconception care module, we were also thinking that why we are discussing vaccination for the women in the reproductive age group, but it is equally important. So for the women in reproductive age group, for hepatitis B, we should say that use a 3-dose schedule, 0, 2, and 6 months if the mother has not taken earlier. Now, most people think that why we are talking about hepatitis B because most of the females have taken. So still 82 to 85% coverage is what most surveys claim as far as immunization is concerned. And in the remote and rural areas, many women in the previous era have actually missed out on these vaccinations. Coming to spaced 4 to 12 weeks apart if there is history of no prior varicella infection or vaccination. MMR should be taken 2 doses spaced at 4 weeks apart if it is not taken earlier.
What about
Coming
HPV?
to HPV. Yeah, ma'am. HPV, as you all know, IAP is totally focusing on getting HPV vaccination to the forefront. So it can be given 2 doses at 0 to 6 months of the quadrivalent or the nonavalent vaccine for adolescents aged 9 to 15 years. And 3 doses are to be given at 0, 2, and 6 months for all adults who are more than 15 years up to 26. Actually licensed to be used up to 45 years, but earlier the better. So all those female who are in the preconception phase should actually take the vaccine well in time. Also, we can talk about conjugate pneumococcal vaccine in special situations and Japanese encephalitis vaccine 2 doses can be given to women who are belonging to the endemic zones, and this vaccine's doses are given at a difference of 1 month. So these are all the important vaccines to protect mother and the baby. Coming to vaccines which can be given during the pregnancy. So as we all know, Tdap, 1 dose is given at 27 to 36 weeks of gestation. And a different new thing, influenza vaccination. 1 dose can be given after 26 weeks of gestation. We can use inactivated influenza vaccine, which can be administered in pregnancy. The live intranasal vaccine cannot be used. Why we are impressing upon the use of influenza vaccination? Because in many randomized control study, it has been studied that influenza vaccination in the pregnancy can decrease the chances of having small for gestational age baby and premature babies. So vaccination is a vital component in preconception care counseling, and all healthcare providers should give it to the couple who come to them before starting the pregnancy. Thank you, ma'am.
Thank you. Thank you, Manmeet. So we have a list of vaccinations which we can advise. And again, the time zone is at least we have to prepare them, even for giving back, you should have a gap before they conceive. So all this preparation again goes back to 3 to 4 months before the plan of conception is there. So very important to talk about vaccinations. And now coming to another case scenario, Dr. Deepa, please highlight about this, how you can manage this 26-year-old girl, female, has come to you. She's brought a 3-year-old daughter for a regular checkup, and the child is normal. Mother was observed to be less interactive than the previous visits. On further inquiry, we have made out that she's planning her next pregnancy, and she needs advice on the same. She's concerned, and she often looks very tired, feels very tired, she looks as if she has no interest in activities which she has previously enjoyed. She has a poor sleep, and also when you inquire about her sleep hygiene. So can you just tell us, Dr. Deepa, do we have any role about talking about mental health in preconception care? Can we help this lady here? And what is the role of mental health, and what are the recommendations regarding mental health in preconception care?
Okay, ma'am. So coming to the topic, mental well-being and support system. Next slide, please, ma'am. So what is the need for mental well-being in preconception care? It has been observed that 20% of women have a mental health condition either before, during, or after the pregnancy. And antenatal depression and anxiety have been associated with complications like placental insufficiency, preterm labor, and low birth weight. And another important association is maternal depression or anxiety has been shown to be associated with conditions like ADHD, conduct disorders, and emotional problems in the offspring. So some statistics from India. The prevalence of prenatal depression has been found to be 22%. Perinatal depression has been found to be 22%, and that of generalized anxiety disorder, 23%. Another very important statistics is that 7.6% of women in India experience suicidal ideation in pregnancy. So what are the factors affecting mental health of a couple? Certain chronic diseases like diabetes mellitus, epilepsy, asthma, substance abuse affects the mental health adversely. Relationship issues can be there, like marital conflicts, interpersonal violence. Also, social and economic factors like gender inequalities, socioeconomic deprivation, inadequate support system. Everything adversely affects the mental health of the couple. So what are the
different types of mental health problems that we can identify?
Yes, we see depression, psychosis, and manic disorders. Bipolar mood disorder is very common. Anxiety disorders like panic disorder, generalized anxiety disorder, obsessive compulsive disorders. What is tocophobia? Tocophobia is the phobia for childbirth. Eating disorders and post-traumatic stress disorders are seen. Pre-existing mental health conditions are seen to worsen or relapse during pregnancy.
So do we have any screening tools? Can we tell our pediatricians some basic screening tools to identify this?
Yes, these are the validated screening tools. For anxiety, we have the SCARED. For depression, we have PHQ-2 and PHQ-9. For suicidality, we have the ASK screening questionnaire. For post-traumatic stress disorder, we have PTSD checklist. For somatization, we have PHQ-15. And Kimberley-Young scale is for internet addiction, which is very common these days.
At the end, can you please tell us the recommendations for good mental health? Including a support system.
Yes, ma'am. Every woman needs to be screened for mental health problems before conception and during antenatal visits. Regular physical activity, nutritious diet both reduces stress and anxiety. Women who require mental health support should be referred to a maternal mental health team. So what does this team consist of? It consists of a social worker, a gynecologist, a psychologist, and a psychiatrist.
So every woman needs to be screened. That is the key message. So every woman, not just man, both I think men and women have to be screened for mental health problems. So existing problems have to be identified, or we also have to be aware they can be exacerbated. So very, very important to screen them. And we also have to discuss about the other things. Please, Deepa.
Yeah. The safety profile of ongoing medications. Quetiapine and olanzapine are two antipsychotics that are safe in pregnancy. We need to recommend cognitive behavioral therapy if there is an issue with the thought process. And 7 to 8 hours of uninterrupted sleep is important. And alternate therapies like yoga also helps in reducing depression, anxiety, and stress in pregnancy.
Deepa, can you just briefly mention about relationship issues? So, between the wife and husband, maybe the in-laws or the family, there can be some issues. This can affect the preparation for preconception. And any role of the support systems, which is now, deteriorating in India. We are having more nuclear families, hardly any friends. We have only social, the media friends are there on the Facebook and all. The real friends, what is the real support system? The role of the support system, financial support, all these things. Can you just briefly elaborate on this?
Okay.
How to handle and the role of the support system?
So what is premarital relationship? Premarital relationship is a period in which two distinct people who do not know each other, they learn to know and understand each other, as well as they form bonds that are required to live together before they decide to marry. And conjugal relationship is related to marriage. That's for married persons and their relationships. Now, studies have shown that the rates of premarital sex in North India, 17% of school children and 22% among young workers enter into premarital sex. And the recent change in lifestyle of adolescents, the delay in marriage, premarital relationships, premarital sex, live-in relationships, increasing prevalence of separation and divorce, all underline the need for right knowledge and skills to be imparted to our adolescents so that they can balance their relationships throughout their life.
Recommendations.
Recommendations include, we need to raise community awareness on the advantages and disadvantages of premarital relationships. We have to instill practical interpersonal skills in adolescents and young adults. Inform the couple and providers about the government schemes available, the internet resources available, the self-directed materials available, and also make extra efforts to connect with the vulnerable couples.
Thank you. So very important. And
Yes,
should we include this premarital counseling in our day-to-day programs, including the government initiatives? Is it already there?
Yeah, it's there, ma'am. For all government initiatives, especially the adolescent reproductive and sexual health program, which is there for teenagers, this has to be included.
This is a very favorite topic of Dr. M.K. Nair, premarital counseling. So, we have to talk about counseling even before marriage or before they want to conceive. So, this is so important. There hardly people are there to give them this type of counseling. Parents are also sometimes not so communicative. So where do they go, the young adults? So let us help them out. I think that is the message we want to give through this. Now over to you, Dr. Prashant. Thank you, Deepa. Dr. Prashant, you are a very tech-savvy person and you are also an expert on substance abuse. So please tell us, we see a lot of smoking, alcoholism, young adults want to just enjoy life. And this incidence is really rising, including drugs. So what is the role of this substance abuse in preconception care? Does it impact fertility and the developing fetus? How will you identify and manage it, Dr. Prashant?
So thank you so much, ma'am. As we all know, the substance abuse has been increasing in adolescents and young adults. There are multiple reasons, may it be experimentation or addiction. But these substances, including the alcohol, tobacco, or the recreational drugs, they impair fertility not only in the male but also in the female also. This consumption of alcohol and tobacco will lead to decreased sperm quality as well as quantity in men, and in female it will lead to a menstrual irregularities and the qualities of the eggs as well as the ovulatory dysfunctions will be there. Some drugs like the marijuana, cocaine, and opioids, they can disrupt the hormone levels and again interrupt the ovulation and decrease the sperm productions. So this substances usually, if taken during the preconception part, can increase the risk of miscarriage, stillbirth, and birth defects in the developing fetus. So this is why it's important. Now there is a evidence.
How to screen?
Yeah, there is evidence that if we screen them, then we can actually decrease the all these birth events which are happening. Screening girls for tobacco by all visits by using 5A steps approach, which is very well given by Dr. Sodhi ma'am in her article. That if you ask about the substance abuse, we usually don't ask that it is not common in girls, so don't ask, but we have to ask. Once we ask, then we have to advise that these are the advantages, these are the disadvantages of consuming the substances. While doing this, we must assess for the signs and symptoms which are present of the substance abuse. And if you find any signs and symptoms, then you must assist them. And most important is arrange for their further follow-up. Further treatment is most important. Many times we are not ready to ask the questions, and for that we do have some screening questionnaires like the screening and brief intervention and referral treatments like SBIRT or the CRAFT questionnaires, which are commonly used screening tests. Now, when we talk about this CRAFT, it's a very simple version, a 2.1 version, which is there, in which there are two parts, part A and part B. So in part A, you just ask few questions and you ask them that please be honest, and these answers will be kept confidential. So we asked them during the past 12 months, on previous slide, during past 12 months, how many times you actually consumed beer, wine, any drink containing alcohol? If they say 0, then none. If marijuana or synthetic marijuana or any other medications. So all these three things, we just ask it. And if any question to this is yes, then first, next slide, ma'am. We go to the part B. In part B, there is a CRAFT questionnaire. So first question is to be asked if 0 is the answer for all questions in part A. That means, have you ever ridden in a car driven by someone who was high or had been using alcohol or drugs? So this is the only question we ask if 0 scoring was there in part A. But if it is not 0, then we ask all 6 questions. Like after C, we ask, do you take alcohol or drugs to relax? When you are alone, are you taking these drugs? While you take these drugs, often you forget the things, or your family and friends often tell you that you should cut down on your habit of these things, and T for the trouble. So all these 6 things should be there. And if we find that 2 or more yes answers are there, that means there is a serious problem. See, as we already seen, CRAFT score in initial A, if it was all zeros, in last 12 months, the person has not taken anything. That means the score risk level is 0. In that case, most important thing is we provide information about this substance abuse as well as the disadvantages, and most important, praise them and encourage them to continue the same habit. If we found that there was no use in past 12 months, but CAR question only was positive, then again we reinforce them, give them brief advices, and possible follow-up visit is there. But if high, that means more than 2 yes are there, that means this has to be sent possibly for the counseling as well as the treatment. So this is how the substance abuse should be there. And there are some recommendations that we must educate women about the negative effect of alcohol, tobacco dependence, and drugs during the pregnancy. There are so many mothers who are actually asking about this, that whether they are pregnant or lactating, this should be taken or not, then there should be a strict no to that. Some pharmacotherapeutic and psychosocial intervention has to be done for assisting them in quitting the smoking. And we must advise both men and women to discontinue smoking, drinking. See, many a times smoking men is doing, but the harm, a passive smoke is harming a woman also. So that should be, that should be discouraged. And we must link between this preconception tobacco use and increase risk to us of a sperm DNA damage. And most important is this sperm DNA damage can cause cancer in the offspring also. So that is most important. So we must emphasize that there is no known safe level of alcohol consumption during pregnancy, and we must recommend it abstaining from alcohol entirely. So this is what
Complete
in
no,
short.
complete no to all these things 4 months before you plan conception. Thank
Yes.
you, Prashant. Important issues you have discussed, because we need to little hurry up for time constraint. And I know before I think we invite questions from the audience, from those who are in our webinar. We can look at the question box little later. So at the end, I think we have covered most important areas. Preconception care is a very vast topic. We have a module running over 3 to 4 hours, and we try to give the important messages through this webinar. The importance of being eumetabolic, what are the recommendations regarding diet, the body weight, exercise, fitness, and how to screen yourself from hypothyroidism, look at your blood pressure, whether you are diabetic or not. If you have a bad obstetric history, look for genetic issues, what is your family history, and screen yourself for genetic issues and take some counseling if there's already a carrier state. So, and we also discussed about mental well-being. We also discussed about reproductive health issues in the male and the female, and of course the substance abuse and mental health. So with this, I think we all would like to have a checklist. So because itna sara baat kar liya, so can we have a checklist for just we can give to young couple? Yeah, आप ये सब check कर लो before you are planning pregnancy. So with this could be the checklist we can advise regarding diet. We have to definitely talk to them about nutritional requirements, especially about folic acid, because this is all the time we are missing it. The important critical period is over by the time we know they are conceived. So we have to tell them we plan pregnancy 4 months before. You have to start doing all this. Nutritional requirements, take care of folic acid, have a healthy diet with special emphasis on micronutrients. Regarding the weight, we have to tell them what is the appropriate BMI, not to be underweight or overweight, especially in the reproductive age group. And regarding exercise, advise 150 minutes of exercise per week or 30 minutes on most days. And about genetic screening, if there's an indication in the personal or family history, or when there's an ethnic background, we have to screen them for genetic disorders. And regarding smoking, alcohol, and drugs, we have to assess the intake and give appropriate advice. Complete no to alcohol, even a small amount cannot be allowed, alcohol or smoking. Psychosocial aspects, screen for domestic violence, because it's very, very extremely important to have a good interpersonal relationship between the wife or the husband or both the couple partners. And issues of any aggression in the family is not good. It can cause mental health issues. Look for this violence and offer help. At least we can guide them where they can go, and look for any pre-existing mental health issues and provide appropriate management. And regarding mental conditions, medical conditions, we have to review their current disease status. Look for diabetes, thyroid dysfunction, etc., which you have mentioned. And you have to ask them to become eumetabolic before they conceive. So assess their work, home, and recreational environment. We have to see whether they have good family support, financial support, whether they're ready to welcome the first baby or the second baby. So creating life is not just about just coming together. We have to see that whether we are prepared to bring in the new life into, and whether we can nurture them, whether they are prepared to nurture. Dental health checkup is also extremely important. There's a relation between dental caries and abortions. So look at the dental health also. Screen for sexually transmitted infections and other infectious diseases, measles, mumps, rubella, the varicella, hepatitis B, HIV, hepatitis C, and do a pre-test counseling for these issues. And also for cervical cancer, screening has to be advised. Vaccination is extremely important. A list of vaccines. Manmeet has told us what we can recommend for the young couple. So this is about our preconception care. This is the checklist, what we all from the panel would like to suggest to our where we are pediatricians who have joined in. This is thank you for giving an opportunity. We'll look into the chat box to see whether there are any questions.
Ma'am, 1 or 2 questions were there which were answered. So I think next, if they want to ask, they can ask.
Yeah, anybody that I think the floor is open for any questions. We have another few minutes. This is a new topic. I think I hope more and more webinars are conducted and we can create awareness about preconception care for our young adults all over India. And we are the first organization to do that. IAP is coming out with preconception care guidelines, which will be published very soon. So thank you, and I thank my panelists. If there are no questions, maybe
I have a question.
Atanu, yes. Yes, Atanu, bye. We missed you in the introductory. Thank you for your presence. Yeah.
Excellent discussion. And I can see all the galaxy of adolescents. And I would give just a suggestion. Why can't we come up with a preconception booklet for on behalf of the adolescent chapter? I think that would be game changer. That would be a game changer really, because we have antenatal booklets, but we haven't seen a preconception booklet. I think that would be very, very necessary, incorporating all this discussion. And Prashant can put it in the website also, so that we can download it from
Dr. Atanuba Dada, for giving this idea. We talked about early child development, then we went little beyond to say 1,000 days of life, and we came out with a very good module, Epic 1000, we did all over the country. Then we are just moving, even for 1,000 days, we need to prepare. So preconception care is another, just going beyond the 1,000 days. So preparing for 1,000 days, we require another preparation, that is preconception care preparation. So really, this will again come into the domain of Adolescent Health Academy, and this is a good idea. We'll come out with something like a booklet and a checklist.
Geeta ma'am, I think will have her hands full this year, and this would be a great launch.
I just was on phone. Yes, definitely.
What Atanu is saying, AHA can come out with a booklet on PCC, which will be very useful for the young adults.
Absolutely. Himabindu madam will take a lead. We will be there with her.
Yeah, thank you, sir. We'll definitely think about and we'll do it under AHA. Thank you. Any other questions or any suggestions for this topic from? Yes, sir. Kusukanta, sir.
Yes, I would rather suggest a very nice discussions and useful, I must say. Successful lactation being in the antenatal care, but we can also think of, because this is one of the very important area where the pediatrician is really struggling after the baby is born. So not just leaving to the antenatal care, we can just have some points included here also.
To promote breastfeeding. Yes, sir.
Yes,
for young adults,
yes.
it is there in our big
breastfeeding.
module, sir. We are not maybe mentioned here, but it is there part of the breastfeed, the PCC module.
Because it's antenatal
we'll mention
care,
that.
definitely, but that's very
Checklist
important.
mein add Dr. Prashant. Yes. Yes, sir. Good suggestion.
Ma'am, I just want to say something. See, in our culture, we never go out of our homes unprepared. We never go unprepared for any small thing in our life. We always do preparations. So once we are conceiving, we are bringing out a life. Preconception care is that preparation. So if we are well prepared, the outcome will always be good. So I think we all need to focus on this preparation, which brings life to the world. So I think that is where it should all start.
Rightly said. Because we prepared for our MBBS seat, we prepared for our jobs, we prepared for so many exams, but we never prepare for such an important task of life, to be a parent. Just to bring out a life, to create a life and care for the life, there's no preparation at all. I think this was there's this big gap. I think we have to do such a noble task to conceive. It is God's gift to get the life into existence into this world. And we pediatricians are the first one to welcome in the labor room. We are the ones who receive the babies. Just imagine this, in utero, this baby as a fetus has been nurtured in certain environment. That environment can be improved by a proper preconception care. So we are thinking of prophylactic and preventive methods, how to give the very best to our next generation. So environment factors, mental factors, mother and father or the partners, both of them, they can do a lot to prepare themselves 4 months before they want to conceive. This is the key message. Absolutely true, Dr. Manmeet. There is a preparation for everything. Why not for conceiving a child? And it is high time we all propagate about preconception care. And we have to demystify, remove the shyness around this topic, talk like two scientific people. After all, we are all getting married. Marriage को बहुत अच्छा से celebrate करते हैं. Many people come to look at, marriage को देखने आते हैं, bless करने आते हैं. We all know after marriage what happens, but nobody talks about it. They just conceive. So why nobody talks about it? The family should talk, everybody should talk. There should be professional experts, and there should be some platforms or clinics. I would actually look, my futuristic vision is to look at preconception care clinics being propagated in India.
Right,
PCC
madam.
clinics should be the way forward. And like we have ECD clinics, we should have PCC clinics. So I hope we can look into it. This is only a small thought which came into our mind about a year back, and we started thinking about developing guidelines, recommendations. We'll develop a booklet and also try to propagate PCC clinics being established.
Thank you, Himabindu. But don't forget to partner with our Foxy also. So,
Yes.
Right.
Definitely, we need to have them on board because they are also dealing with young, but they see only females. It is, I think we are more broader. Both of us have to partner, and like Dr. Sukant has already taken PSM also. Definitely, we can collaborate, but let us take a lead to develop and establish PCC clinics all over the country. This is the new vision. And let us move forward. If all of you support, definitely through HA, we can all do that. Dr. Aryan Sharma ji, please some suggestions from your side.
Yes, ma'am. Very good suggestion from this house. We should move forward for making clinics, preconception.
Thank you, sir. Dr. Harinder Singh ji is here. Prakash Virariya ji.
Yeah, good evening.
आज का जो yes, sir, आप
नहीं बोलिए सर, बोलिए.
सर बस यही है जो आज का जो मेन जो निष्कर्ष निकला है कि पीसीसी क्लिनिक रियली ए वंडरफुल आइडिया, और इसको आगे बढ़ाना बहुत बहुत अच्छा रहेगा, और इसके लिए अपन आगे चलेंगे.
थैंक यू. वी मेक अ वेरी स्मॉल चेकलिस्ट. क्या देखना है, क्या करना है.
बस that's all.
Yeah, Dr. Himabindu, very nicely put forward this PCC counseling. One thing I want to put forward, we can have some TOT like we have in ECD, and subsequently we can put a board on our clinic that we are the PCC counselors.
Experts.
That will help in
Thank you, sir. Sneha, treasurer of HA.
Even if the TOT does not happen, we all have to be PCC counselors.
Yeah,
that's for sure. We have to.
Yeah.
Definitely, sir. This is only sensitization. A webinar of 1 hour cannot cover extensively on this, but we try to sensitize everybody on this topic of PCC. I really thank Dr. Prashant, Kariya, Dr. Deepa, Janardan, Manmeet, who have been with me like an army, like, they are the foot soldiers. They are in the forefront. I just conceived this idea of having a preconception care module or a position statement. They are delivering it. So whole credit goes to my team, and thank you. There are many others who are there part of this team, and we would like your cooperation from West Bengal Adolescent Health Academy for propagating this message of developing a preconception care concept, and how we can talk about this in our clinics through our AHA members. We can definitely create a change for the next generation.
So we must
over
thank
to you,
Mr.
Ashim Ghoshi.
Yeah, Ashim.
Dr.
Thank you.
Thank you for giving us an opportunity.
Just a few parting words, madam.
Yes.
Wonderful moderation, power pack performance, all the facets covered. What more can we expect, the West Bengal people? I can see in front of me the top brass of AHA. The ex-chairperson, the president, the present chairperson, president-elect, ex-secretary, secretary, treasurer, Dr. Harinder Singh. It's a galaxy of stars, and we are just overwhelmed. Thank you for the unstinted support that you all are giving us and your blessings so that we can move forward. And I would lastly request Dr. Champak Das, as chairperson of WBHA, to say a few words. Thank you.
Thank you for joining us. You are really overwhelmed as per Ashim. The galaxy of stars are really, we have learned a lot from this galaxy of stars. More will come in future, and we shall always invite you to enlighten us. Thank you. Thank you for joining.
Thank you, Champak Das ji. Thank you so much. Thank you once again. Thank you one and all.
Thank you. Good night, everyone. Thank you.
Thank you so much.
Good night. Good night.
Thank you.